So we're talking about the skeleton, and the skeleton consists of two parts, the axial skeleton and the appendicular skeleton. The axial skeleton is everything in the axis, like the skull, the vertebral column, and the thoracic cage. This is called the axial skeleton. The appendicular skeleton is anything that's appended to the axis. So like this is the shoulder girdle, this is the upper limb, and this is the pelvic girdle and the lower limb. This is called the appendicular skeleton. We're going to start with the axial skeleton. The axial skeleton is the skull and the vertebral column and the thoracic cage. So we started with the skull. The skull consists of cranial bones. These are the skull bones and the facial bones. The cranial bones are 8. One is the frontal, one in the back. This is occipital. So that's 2 so far. We have 2 parietal. That's 4. 2 temporal. That's 6. And then 1 sphenoidal and 1 ethmoidal. So these are the 8 cranial bones. The frontal bones are these bones in the front, and this is the orbital foramen, the 2 orbital foramina, and you can always start like the bones from here, and you can call it never mindless, NMLES. Can you pause for a second? So if you look at this skull here, this green one here is the frontal. This one brown in the back, this is the occipital. You have 2 parietal, which is the yellow, and this is 2 temporal, which is on either side. And then you have the yellow here, which is the sphenoid, which is this and this. This is just the 2 ends of the sphenoid bone, but the sphenoid bone itself is 1 bone, and it's connected from inside. That's why they call it 1. So frontal, that's 1, occipital, that's 1, so 2. The sphenoid 3, the ethmoid 4, and 2 doubles. This is 2 parietals, and this is 2 temporal bones. These are the 8 cranial bones. The facial bones now, the facial bones will be as follows. You can call it never mind less, LES. Never N, which is the nasal bones, these bones here. The second part will be extension from the maxillary bone, so this is M, which is the maxillary. L, this is the lacrimal, this is the location of the lacrimal duct. N, L, lacrimal. And E is for the ethmoidal bone. And the last one, which is the yellow inside that contain all the foramina here, this is the sphenoid. So N, M, L, E, S, never mind less. These are the bones here. This is the maxillary bone, this is the zygomatic bone, and this zygomatic bone again, and you see this arch, this is called the zygomatic arch. This little part here, which is protruding from the zygomatic bone, this is called the temporal process of the zygomatic bone. This is part of the arch. And the second part, which is the purple here, it's coming from the temporal bone, so this is called the zygomatic process of the temporal bone. Those 2 together, which is this part here, this is called the zygomatic arch, 2 parts. And there's a suture in between here, separation in between. So this little part here, temporal process of zygomatic arch, and this large part here, this is the zygomatic process of the temporal bone. We also have this bone here, which is the mandible. This is the body of the mandible. This is called the ramus of the mandible, like a branch coming from the body. This is the angle. This is the condylar process, and this is the head. This is the coronoid process. These are the mental foramina. This part is called the mentis, which is the front part of the bone of the chin. So this is called the mental foramina. And if you go back here, this is the nasal bone. And if you look inside, this is the nasal septum inside. This is the bony part. The cartilaginous part is removed because this is only bone. And you can also look inside. You see this one here, which is the inferior meatus. And the second one here is the middle. Concha, sorry, not meatus, concha. This is the inferior nasal concha. This is the middle nasal concha. The superior one is hiding up, so we don't really see it. So we can see the middle and the inferior nasal meatus. Pause. Okay. If you look here, you will see separation, sutures, like you're suturing something. Sutures between these bones. This suture right here is called the coronal suture, which separates the frontal bone from the 2 parietal bones. The 2 parietal bones themselves are separated by sagittal suture because it's in the sagittal plane or sagittal section. So this is sagittal and this is in the coronal. So this is coronal, this is sagittal, and this one looks like a lambda. So this is a lambdoid suture that separates the 2 parietals from this occipital. If you look here, this is called the squamous suture, which is separating the temporal bone from the parietal, and this one is called the temporosphenoidal suture, which separates the temporal bone from the sphenoidal bone. If you look at the other parts of the skull, this is called the mastoid process. This is called the styloid process. This foramen here is called the external acoustic or external auditory meatus, which is this one. There's another one that's inside. So this is one end, external acoustic or external auditory, and the other one is inside. Okay, so the first part of the skull, we did the superior view, the lateral view, and the inferior view. And the next part of, or the second part, this would be the second video for the skull. ISO is ISO. The best way to see them is from this view, from the anterior view, and ISO is inferior, which is this one down here, the inferior orbital fissure. And the next one will be superior orbital fissure, which is the S. And the O will be the optic foramen here. So ISO, inferior orbital fissure. It's a fissure in the orbit. This is the orbit. This is the inferior of the orbit. This is the fissure, inferior orbital fissure. And this is another fissure that's superior. So superior orbital fissure. And the O is the optic foramen or optic canal. Also, if you're looking a little bit at the nose, you will see right here in the middle, this is the nasal septum, and the nasal septum is usually two parts. This is the bony part, and the cartilaginous part is gone. It decays after death. So this is the part here. The major part, all of this here, this is called the perpendicular plate of ethmoid. This part down here, this little part here, this is called the vomer. So perpendicular plate of ethmoid is the major part, and the vomer is this part. Both of them together will make the bony nasal septum. And actually, if you can look inside here, this is the inferior nasal concha. This is the middle nasal concha. The superior is more up here, so you don't see it from this view. So inferior nasal concha and the superior nasal concha. Now, if we opened the skull and look at it from inside, you will see three cavities here. This one in the front here, this is called the anterior cranial fossa. This one here is the middle cranial fossa, and this fossa down here, this is the posterior cranial fossa. Superior cranial or anterior cranial fossa, anterior, middle, and posterior. Anterior cranial fossa, actually, you will see these plates or these plates right here. It's not the best in this model, but it should be perforated, and this is what we call the Cribriform Plate of ethmoid. And right here in the middle, this is called the cresta galli. Cresta galli means the rooster's horn, or cresta means crest or elevation like this, and galli means like rooster or something. So this part in the middle here is cresta galli. On either side of the cresta galli is the Cribriform Plate of ethmoid. If you go down here, this is the middle one, and this is called, this looks like bad shape here. This will be the lesser wing of sphenoid. This bone is called the sphenoid bone. This is the lesser wing, and this large wing here, this will be the greater wing. So this is like a bat with two wings, lesser wing and greater wing. This part here, still in the middle cranial fossa, this will be the sella turcica, and the sella turcica is saddle horse. Sella turcica, saddle horse. This is the location of the pituitary gland, also known as hypophyseal gland. It should be located in this area right here. This bone, this large bone here, this is called the petrous bone. So there are two foramina on the petrous bone. This one here, which is located in the posterior cranial cavity. This would be the internal acoustic meatus, which is the other side of the external acoustic meatus that we talked about before. Here is the external, and here is the internal. So this is the internal acoustic or internal auditory meatus, and on the other side, this will be the carotid. So those two foramina are located on the petrous bone. This one here on the petrous bone from the posterior fossa, this will be the internal acoustic meatus or internal auditory meatus, and this one in the front here, which is in the middle cranial fossa, this will be the carotid. So here, if you look here at the posterior, there's this is called the internal occipital protuberance, which is the protuberance or the protrusion that is on the other side of the external occipital protuberance. And these are the superior and inferior nuchal lines. And that's it for the adult skull. Let's take a look real quick on the fetal skull. And the fetal skull, if you compare it to the adult skull, you see here, this is the coronal suture and this is the axial suture. At the meeting of these sutures, there is a point here that in adults it's closed. There is nothing really here, and another point here. And so if you look at the fetal skull here, you will see something different. You see here at this point, which is the intersection between the coronal suture and the axial suture, you will see an actual opening here. There is no bone here, just a membrane, to the extent that if you push it down like this, you can actually go to the inside fluids with CSF, and you can go to the brain actually, because this is just a membrane. It's not ossified yet, it's not bony tissue yet, and this is called the anterior fontanelle. And there's actually an extended part from the sagittal suture. So this is the first thing that's different in the fetal skull. The second thing is, if you look down here at the meeting of the sagittal to the lambdoid suture, there's another point here that have another fontanelle. That's the posterior fontanelle. So anterior fontanelle, posterior fontanelle. And if you look at the side here, you will see that at this point, this is the anterior lateral fontanelle, and this is the posterior lateral fontanelle down here. Same on the other side. Anterolateral and posterolateral fontanelles. So these are the differences. We have 6 fontanelles: anterior fontanelle, posterior fontanelle, one on either side. That's anterolateral fontanelle, which is at the meeting of coronal with the squamous, and here it is temporosphenoidal or sphenotemporal temporosphenoidal suture. So at this point here, which is the pterion, this is the location of the anterolateral fontanelle. The other one here, which is location where the lambdoid will meet the squamous suture. So at this point here, you have the posterolateral, same on the other side. So the main difference is the 6 fontanelles, and that's it for the skull.